Hello, I'm Vasant Andrews. I'm a consultant obstetrician and gynaecologist, and I work at Gynaecologists in central London in Harley Street. I specialise in supporting women with their recovery after childbirth, particularly when things don't feel quite as they should. Following childbirth, most perineal wounds, whether they're from a tear or an episiotomy, heal well with time and basic care. However, in some cases, the wound may not heal as expected. This is known as a perineal wound breakdown, and it can be both physically uncomfortable and quite understandably distressing. Women may notice increasing pain rather than an improvement, a feeling that the stitches have come apart. They may have a persistent discharge, bleeding, or an open area that does not seem to be healing. If this occurs, it's important to recognise that this is not simply something to wait out. Wound breakdown can happen for a number of reasons: tension on the stitches, for example, an infection, or a reduced blood supply to the area. And whilst it's not uncommon, it does require careful and considered management. The key is early specialist assessment. In my practice, I take a meticulous and individualised approach to these situations. This involves assessing the extent of the wound, the quality of the surrounding tissues, and identifying any contributing factors that may be delaying healing. Management is then tailored to you. In some cases, supporting the body's natural healing process is appropriate. In others, we may recommend refined resuturing techniques performed under optimal conditions to promote more effective healing and improved long-term comfort. Equally important is ensuring that the pain is well controlled, that infection is treated promptly, and that you feel supported throughout the process. What I often see is that women are reassured to give it time, despite ongoing symptoms. But when healing is not progressing as it should, timely intervention can make a significant difference, both physically and emotionally. Your recovery after childbirth should feel steady and complete, not uncertain or prolonged. If you have concerns about your perineal wound or how it's healing, it is entirely appropriate to seek a more specialist review. With the right care, healing can be restored and comfort regained. If your recovery does not feel quite right, it's worth having it properly assessed. I offer dedicated, unhurried postnatal consultations with a focus on restoring comfort, function, and confidence. You're welcome to get in touch.